Hi, I am DrLeela Mohan PVR. I'm internal medicine consultant and physician. I mainly practice in motherhood and Manipal. I have my own center called as Padithem Healthcare, that is in HSR layout, Bangalore. Restless leg syndrome is nothing but improper movements, or what in the local language or normal language we'll call it as like unauthorized movements. There are two types of restless leg syndrome. One is primary RLS, we'll call it as, and secondary RLS. The primary RLS, the cause mainly we don't know. It can be a neurological disorder. It can be triggered due to any other reasons. The secondary RLS is can be caused mainly due to the iron deficiency anemia, or if the person is having any kidney related impairments or kidney diseases, and some other metabolic disorders also can trigger this problem. Restless leg syndrome is nothing but disease. We'll also call it as Willis Ekbom disease. So usually it is characterized by improper movements, or what we say unauthorized movements, or we won't be knowing when we are doing movements. Basically it is a neurological disorder. The patient sometimes will not be aware also the movements are happening in the leg, and sometimes they will be knowing also which will not be under their control during they are sitting at one place in the chair, or during sleep, or when they are on the bed. Some people usually say it increases over the night. Basically it is a neurological disorder. So causes which mainly include, as I said, iron deficiency anemia, or if any iron deficiency, if anybody is having, if the hemoglobin is less than 5 or something like that, or if the serum ferritin levels, if they are low, the patient can develop this restless leg syndrome. That is a main cause. And genetic predisposition. There are certain categories of families or people, they can easily develop this restless syndrome. Pregnancy also is one of the main cause for this restless leg syndrome. Usually it occurs mainly in third trimester, but not every pregnant people will get it. There are certain people they can develop this restless leg syndrome. And then other medications, there are certain medications like antipsychotic drugs, and then there are medicines which have been taken for depression. All medications also, as a side effect, this RLS can be caused. So there are certain chronic diseases like kidney diseases and all also can cause this restless leg syndrome. The main symptoms usually the patient feels aching of legs, itching over the legs, or crawling feeling, or tingling sensation in the legs. During the night, usually they feel it more, and then it can cause uncontrollable movements, or as I said, unauthorized movements of your own legs without knowing to yourself also can happen. So these are the major symptoms in this problem. So how do we diagnose this RLS? The medical history. We have to observe the medical history of the patient when they are saying to us. We have to clearly understand the history. That is one of the major important diagnosis tool for us. And other thing is the blood test. As usual, it is there. We can find out the iron deficiency anemia, or we can get it done the iron profile, serum ferritin levels, iron levels, all other blood tests. So physical examination, examining legs and other body parts also helps in diagnosing the restless leg syndrome. Sleep study is of the study, we'll call it as polysomnography, which mainly helps in determining restless leg syndrome. I'll tell you how to, how we'll treat this thing. Mainly the lifestyle changes, doing the physical activity, regularly doing 30 to 40 minutes walking per day, taking regular physiotherapy sessions at your home, or going to the physiotherapist place, which will help you in treating the disease. Certain medications will give the iron supplements, which will be available in the market, or even your doctor can provide, or your nearest pharmacist guy can provide these tablets very easily. And benzodiazepines, these are the drugs which will be available by the doctor's prescription. And opioids are certain drugs which will help you in treating the problem. So establishing regular sleep pattern will also help you in treating half of problem, and avoiding certain drugs and such as caffeine, and avoid drinking outside beverages also will help you in regulating this disease. Basically, this disease treatment is mainly tailored by your physician. That means like depend upon the symptoms, or like how many times you are getting the episodes in the night. Depend upon that, the treatment will be planned. So you should consult your doctor for the same.